absolutely doing this type of work, your investigative reporting on this and putting it out there has an impact because it brings it to awareness. And by the way, we'll get more phone calls of people saying, you know what, this happened to me.
That is Congresswoman Susie Lee there crediting our 8 News Now investigators reporting about surprise health care bills amid the push to stop these surprises from happening in the first place. Now, our 8 News Now investigators digging into why a mother who called 911 was later billed nearly $2,000 for an ambulance ride.
That story getting a lot of attention amid a push to change that law. 8 News Now investigator David Charnes with more from the Congresswoman. And what's happening now in D.C.?
Well, a lot of people saw that story, whether on 8newsnow.com or on our YouTube page. A lot of you surprised to find out, just like the mom we introduced you to, insurance may not cover an emergency ambulance ride, or that medical care itself can cost any money at all.
Like, what other options do we have? We don't. And so you kind of feel like you're being taken advantage of your crisis.
It was a crisis for Caitlin Lopez that escalated into months of agony. In January, her then 11-month-old son Maxon suffered a seizure inside their North Las Vegas home.
And that's when I thought, like, okay, he's gonna go. And I'm like shouting, like, he's gonna die, like he's not breathing.
First responders brought Maxon in a city ambulance to the hospital, where doctors checked him out and released him. Months later, Maxon is just fine. But Lopez's stress level and bank account, they're the ones that took the hit. When a bill for $1,624 came in the mail, United Healthcare, the family's health insurer, initially denying the claim, citing out-of-network care. But after the 8 News Now investigators got involved, a spokesperson cited some confusion. Ultimately, United Healthcare covered the ambulance ride under the family's plan.
This is certainly an area where we need improvement.
Democratic Congresswoman Susie Lee saw the story, one she says affects Nevadans every day.
Remember, this woman had health insurance. She thought she was covered.
A 2022 federal law, fittingly called the No Surprises Act, protects consumers from medical bills, but it doesn't apply to ground ambulances, like the one that brought Max into the hospital. Patricia Kelmar, a consumer advocate, is trying to change that.
Do you think there will be a day in our country where these surprise ambulance bills are a thing of the past?
It's my everyday goal to make sure that surprise billing protections occur for all ambulance rides. It is just common sense that our insurance would cover ambulance transportation for the care that we need.
Kelmar worked on a committee in Washington that ultimately gave Congress a report on why they should amend the law to include these ambulance rides. She says without any oversight,
it's just setting us all up for not understanding why these prices are the way they are, why our insurance isn't covering it, or why our personal responsibility for that part of the bill is so high.
That bill and property taxes, according to a spokesperson for the city, does not offset the cost of providing the ambulance service. Lee and Kelmar say for the insured, like the Lopez family, negotiating for months and fighting for coverage shouldn't have happened at all.
It's certainly something that Congress needs to be focusing on, and we need to update the No Surprise Billing Act to address this issue for sure.
We need members of Congress to step up and introduce legislation so that we can provide ambulance surprise billing protections for everyone in the nation.
Simple as that.
Simple as that.
Maybe not so simple. 20 states led by both Democrats and Republicans have passed their own laws in an attempt to protect their residents from these surprise ambulance bills. Nevada is not one of them. I'm David Charnes, 8 News Now.
One of the recommendations from that group to Congress is to prevent ambulances from billing a patient until after they run it through the patient's insurance. While United Healthcare did cover the ambulance care in this case, Lopez says she's paying $50 a month to pay for part of that coverage.